What do you remember me? Yeah. Well, I thought I saw it. Cool, John.
Good morning, everyone.
Morning.
We'd like to get started. And first on the agenda, if I draw your attention to our screens, you'll see that we have a full agenda today. It will be a full all-day meeting, so this is different from our all-committee meetings. This is our annual summit, and actually it's been 8 years in total now that we've been doing this. So thank you all for making today a success. It's a sold-out event, so I appreciate all your support. Ron and I are going to say a couple words this morning about each of our organizations that jointly put this together. And again, thank both of the organizations as well as the sponsors. And then we're going to get right into the speakers for the day. A couple housekeeping components. If you haven't been here to the Medical Society, the restrooms are right off of the main corridor out front there, just past the registration area. But probably most importantly, we are videotaping this, so it'll be available on our websites afterwards. And because of that videotaping, we ask for your cooperation whenever people are addressing in terms of the question and answers in particular, use the mics, because that'll help us be able to project on the YouTube. So we appreciate your cooperation from that perspective. Let me go back here to the agenda for one other housekeeping event. For lunch, we actually have a keynote speaker. So the lunch goodies will actually be set up in that same room that we have our breakfast set up. But we're asking folks to grab lunch, bring it back to this room in order to participate in that keynote speaker over lunch. And then I would draw your attention to the end of the day. Information Builders, one of our sponsors, will be sponsoring a networking event across the street over at the Best Western. So I hope all can at least stop by and join us for a little bit there. Thank you for Information Builders. Which leads me into, let me see if I get this slide here, oops. Thanking all three of our vendors, DSS, EMC, as well as Information Builders. Please stop by their booth. This is a great opportunity, even though we're sold out. I think we're small enough to allow that interaction and that networking. So please take advantage of being able to stop by and not only thank our sponsors, but learn a little bit about how they can possibly help your organization or your efforts. So thank you again, Buddy, Steve, Joe, Kevin, and John. So stop by and see those. Again, who in the audience? We usually put up a slide like this to kind of just introduce the group. You'll see we have a cross mixture here. So again, another very nice networking opportunity. I think when I looked at the numbers most recently, we have about 75% of the folks that have some connection to either PAeHI or HIMSS and or the CPA HIMSS group. But 25% of the folks in the room are actually new. So we hope you like what you feel and see today, and we encourage you to come back and get involved not only with PAeHI, but with also the CPA HIMSS group. And in particular, I would draw your attention to our PAE HIMSS or our PAeHI website. In particular, our members have asked for almost a PAeHI on the road event, if you will. And in September, we're going to be doing a special event in Pittsburgh and in the Philadelphia area. September, so if you want to mark your calendars, September 19th will be in the Philly area at University of Penn, and September 25th we'll be sponsoring a PAeHI event over in the West at the UPMC facility. So again, a great opportunity not only for networking, but also for getting engaged with the activity that is happening on both sides of our state. So we look forward to seeing you there. I want to finish off before I turn over the mic to Ron with a special thank you to the board of PAeHI. As you can see, the board listed on the screens. We have several folks throughout the room that are actually here present today, and you'll notice that by the various colors on our stickers. There's one more slide that will actually show that, but I think sometimes we don't realize all the efforts that go into planning these events, and I'd like to say special thanks to Buddy, to Gus, as chairs of the committees that work behind the scenes, but a very special thank you to Chris and her administrative assistant, Norma, for really pulling in and keeping us on track. Thank you all for the success of having today be a sold-out event. Again, if you like what you see, I would encourage you to think about becoming a member. Our all-committee meetings offer an opportunity for you to see what we're about and learn what we're about, but getting engaged with us as a member really offers a special opportunity, so please think about that. And without further ado, I'm going to turn it over to Ron to say a few words about the CPA HIMSS group.
Thank you, Sharon. And I would echo those same thank yous to Chris, Buddy, a lot of folks that work very hard to put on a program of this caliber here today. So thank all of you. A little bit about Central Pennsylvania HIMSS. You can see on the slide there who our officers are. Edith Dees, I know Edith is here today. She's back there. Marie Roof is not able to be with us today, but Vinnie Sikors is here. We also have Buddy Gillespie. He's here with us today. And of course, Chris Cavanaugh. She's been rushing around here all morning, making sure this thing goes off just perfectly. And then John Kravitz, I saw walk in the door. John? Okay. Michelle Ziegler, I do not believe is here, or Mark Stevens. I would like to say that we're just a new HIMSS group. We've been started now for about 2 years. Our membership's up to about 470. We've built a little bit of a treasury, so we're able to sustain the necessary funds to put on programs and collaborate with folks like Pennsylvania EHI to bring quality programs to this region. We're very proud of that fact. Later on this year, we're going to transition away from the founding father board that was really just appointed by HIMSS to get started. We're going to transition into an elected board. So the message I have here today is, if you're interested in serving on a board to make a difference, we can use you. We can use you on committees. I think what we need for Central Pennsylvania HIMSS to survive into the future is some human talent, which comes from people in this room. So I ask all of you to really consider, if you have an interest to serve on a board, serve on a committee, to get involved with Central Pennsylvania HIMSS, because we can use you. So with that little spiel about that, I guess I'm supposed to turn it over to you, Buddy, for introduction of our first speaker. Thank you.
Oh, good morning, everyone, and welcome. We're happy to have you here. And as those before me have said, we're looking forward to a great day and an exciting event. It's my real pleasure to introduce our first presenter today, Camilla Hull-Brown, who we all call Cam. And Cam has had the opportunity to work with us now for several years. She was a co-author and key contributor to our financial sustainability white paper that we published a couple of years ago. Cam is the founder and principal for Strategies for Tomorrow, which is a renowned consulting firm across the United States with expertise in both HIT strategic planning and also HIE development and strategy planning. Cam has over 25 years in the field of IT, health IT, and strategic planning. She's also served as interim executive director for several HIEs across the country. She has served on the HIE steering committee for the HIMSS organization. She has a BA in anthropology from the University of Illinois and a Master in Business Administration from the University of New Mexico. And Cam and I were talking about the relationship between anthropology, which is the study of humanity, and health information technology, and we think there's a lot of connection there, so it's kind of an interesting conversation. So please join me in welcoming Cam.
I'm going to try and get my mic on. Is it working? It is? Okay, good. I'm really glad to be back here again. I've seen many of you before, and I know there are many of you who are new. It's just a real joy. Now, I was here a year and a half ago, and so much has happened in the last year and a half. It is absolutely unbelievable. So what I want to do is talk a little bit about that and talk about how we manage this transformation that we are, as a country, going through. Now, I first have to ask a really basic question here. How many of you are familiar with motocross and supercross? Raise your hand. Okay, lots of hands went up. How many are absolutely have no idea what it is? Okay, there's a few hands going up. Okay, actually ran into, just a couple days ago, one of the former motocross national international champions of the 1980s. And he says, well, what is health information exchange, which is what I do. And I'm thinking, oh my God, I will never be able to explain this. This is way too hard because I have a real difficult time explaining that. And oh, by the way, for the ones who don't know, the motocross are the people who leap through the air in the motorcycles. You know, it's very dangerous, and they're racers, and there's a lot of injuries. And so when I tell him that we do data exchange, and no matter where you go in the country, you ought to be able to have your data available. And he's going, this is it. This is what motocross needs. We're very concerned about our riders. We're very concerned that they don't get concussions. We're very concerned. And knowledge is everything. Knowledge in the moment at the race is what we do. They have semi-trucks that have the clinics. They have full medical teams there. They have all the medical records. And this year they started doing computerized testing of response times of the racers before they go into the race, so that if they have an injury during the race, they can compare the results to before. And I'm thinking, these folks are ready. I just talked to our future consumer. He was speaking from the voice of the rider, who is the consumer, who's saying, I want the very best health care, and I want a national network, and I want it now. And he was speaking from the voice of the industry, which is the motocross industry, which says, we take the very best care of our riders, and we want the very best for them. They are our future, and they are just a little piece of a microcosm of all these people that we haven't thought about, or I should say I haven't thought about. I'm sure many of you have. But that's what I want to talk about, is how do we prepare for all of these people who are coming along stream and are getting ready for the health care that they know that they deserve, and we know that we have to get ready for. There's three topics that I want to talk about. One is the assumptions about healthcare transformation, which is just setting the stage. And then there are two important pieces that I want to talk about, which is the network puzzle pieces that are being put in place that didn't really necessarily exist even a couple years ago. And then I want to talk about a healthcare transformation roadmap. When you're going through massive change, how does an organization manage that change process? How do you develop strategy when you can't even predict what's going to happen next year? Because I can guarantee you, a year and a half ago, we did not know what today would look like. This is a map. Many of you have probably seen this already, but to me, it summarizes in one picture the challenge that our country is facing. Along the bottom row, you have premature mortality. The higher mortality you have, the further to the right you are. And on the left-hand side, the per capita medical cost, and the higher your costs are. And see if I can find the pointer here. Is that the pointer? Yes. Right here are the industrialized nations in the country. And they're all kind of clustered together. You can see France has got the lowest mortality rate. I think it's Australia has the lowest cost. And up here, the outlier is the United States. Now, this was back in 2003, and we know from statistics that it is not better. This is a global economic issue. We are not competitive in the global marketplace if we are an outlier compared to the other industrialized nations. So it's a very brief point that I'm making here, is that we have massive healthcare transformation that we have to go through. And it doesn't matter what the Republicans and the Democrats are thinking, or what the private sector is thinking. If we don't solve the problem, we will just keep working on it until we do, because we can't not solve this problem. So one of the things that I'm going to focus on today is the assumption is that healthcare transformation will happen. It may take a decade, it may take 2 decades, but it will happen. And this initiative may fail, or that initiative may fail, or this will succeed, but it will just keep going and going and going until we get it figured out. In this, it creates continuous opportunity and risk, and it doesn't stop because as we keep trying different initiatives, different efforts that work or don't work, we just keep going. So the opportunities are going to continue. And our job is to figure out how we thrive during this transition. Now, I want to focus initially on this network puzzle pieces. Now, has anyone ever seen a map that looks like this before? Actually, this was a map of in the 1990s for the global economy as they were trying to figure out how to, as everyone was dispersing, they had to figure out how to regroup. And I came out of Indiana, which had the auto industry, and you'll notice that Indiana did not have a lot of losses like Detroit, of jobs, because like Detroit did. That's because they dispersed their auto industry 25 years ago. And they had to figure out if manufacturing is going on all over the world and engineering is going on in one part of the world and marketing is going on in a different part of the world, how do you reorganize yourself when you've got the suppliers and the manufacturers? So they had to start thinking this way. So I'm not going to take you through the details of all the levels, but if you look at the bottom level, those are the folks that get the work done. And they're embedded in layers and layers of networks and organization. And at the very top, you have your economic mega groups, and those are your economic development group folks. Those are the folks who say, how do we push life sciences? How do we push manufacturing? How do we push this through to get to the people at the bottom who actually do the work? Now, there's layers and layers of that are occurring, and that is exactly what's happening in our industry right now. The exciting part is that all these layers are happening. But I have some examples here. Down at the bottom, you see the small group. That could be a clinical care team. At the top, economic mega group, I think the national network that ONC is putting together is an economic mega group. They're trying to push from the top and make change happen. Your regional quality reporting networks, they're mega groups. Your alliances are your ACOs. I think PAeHI Health Initiative is an alliance. Your enterprises are those people, there are integrated delivery networks that they have to figure out how we connect our providers and our suppliers and people in the delivery chain. How do we connect them together? And then we have the initiatives that are driven with inside these organizations. Now, what I am proposing is that even 2 or 3 years ago, many of these layers were missing, but as a result of high tech and healthcare reform and many of the initiatives of the private sector, these are starting to fill in. And when these fill in, people begin to see things much more clearly. Oh, we could do this, we could do this, we could do this. So it's not just the visionaries out there who are seeing what could happen, but lots of people are seeing what could happen. One of the points that I also wanted to make was there's this concept of, if you're a visionary and you're out there by yourself and nobody cares what you're doing, then you're ahead of the industry. But when you start to have competition and people are trying to cut you down and beat you and compete, like called the arrow in the back, then the market is moving, and I think what we're seeing is a lot more arrows in the back going on right now. Now, I want to give a couple examples here of what happens when this starts to happen, and I don't have the answers. I'm just describing a couple scenarios of what I see. Now, remember, I come from the health information exchange world, so the examples I'm going to be giving tend to be biased toward that, but they could fit anywhere. But has anyone ever heard of the Wisconsin Health Information Organization before? There's a couple people, yes. I became aware of them in the last year. They are a health analytics exchange. And I was talking to their executive director, and I nearly fell out of my chair when she told me what they were doing because it was so forward-thinking. And what they do is it's a statewide claims exchange. It has all of the health plans in it except Medicare. They're trying to get Medicare to join. It's got nearly every single hospital system. And they've come up with performance measures for the entire state. And everyone who is a member can look at all of the data and do analytics on that data. They look at everybody else's data de-identified, and they look at their own. Identified, so a hospital could go in and see how they compare to the other hospitals in their region across the state by type of care that is being provided. So that's a pretty big deal. And not only have they figured out how to do that, but they've figured out how to get consensus around it. How many of these things have people tried to organize, and they can't get them off the ground because people can't agree to how to measure performance. And they figured out how to come to consensus, and if they haven't come to consensus, how do they do that? So you take something like that, which is, I don't think there's very many in the country, if any, and then say all of a sudden we now have healthcare reform and we're starting ACOs, and they've got the HIEs getting off the ground and the regional extension centers and the training programs. Tell me what is going to happen in Wisconsin. This is going to be unbelievable when they start feeding clinical data. They've already got the players at the table. They already have the procedures to come to consensus. There is something that's going to happen, and it's going to move. And I'm willing to bet that there are not things exactly like this, but things all around the country that are little pockets of innovation and a cluster and enough people engaged and enough entities engaged that something will happen. Here's another one. Anybody heard of HealthLink? It's a, okay, I saw one hand go up there. Very small, very innovative health information exchange. It's so small and so obscure that, it's not obscure, but it's so that when it got started, nobody cared. No one was paying attention. Oh, they're just doing Bloomington, Indiana. Well, it just happened to end up being part of the Indiana Life Science Strategy, oh, by the way, after it got started. And then it's in the middle of the one state, Indiana, that's got, they've got 5 health information exchanges in the state, and they've all been sustainable for many years. And the 2 of them are the large ones. Let's see, a pointer. Okay, this is Indiana Health Information Exchange right here, which they say they're the largest in the country. And then this is HealthBridge, which they say they're the largest in the country. Okay, these folks have 10,000 physicians. All those little stars are all of the physicians that they have. Notice how deep they are into northern Illinois. And then HealthBridge, let's see. Oh, am I pointing in the wrong direction? Oh, what's not moving? How do I get that to move? I know. Chris is controlling it.
Can you advance over there, Chris?
Okay, the other direction. Okay, so this is HealthBridge. Now, they claim they're the largest. If you look at, I'm almost afraid to push a button. This is Cincinnati. That's where they started. Then they grew to Springfield, Ohio. Then they grew to South Central Illinois, or Indiana. Then they grew into Eastern Kentucky, and now they've got Dayton, Ohio. So all of these are all separate entities that just said we're going to outsource our IT infrastructure to HealthBridge. So let me see if I can go back to the other one. There we go. Okay, now take a look at HealthLink. This part of the country is not that great in coordinated care. They have not been advanced in ACO or patient-centered medical home, but they have been very strong in health information exchange. So now Bloomington is very innovative. They got to deal with ACO. They now have a self-insured employer that said to them, we want to do patient-centered medical homes, so they've started this. They're really active in this. And then in the meantime, the point here again, here's PAeHI has the Quality Health First Analytics database, first one to run through an HIE. HealthBridge just announced, and I'll talk a little bit more about that later, they just announced their analytics program. So you've got this little HIE that has access to 2 of the largest HIEs. They're flowing data to both of them. They get the best of both worlds because they get all of the tools and all of the resources of the 2 largest HIEs in the country. Now, you tell me what's going to happen to them. They're going to either be taken over because someone says they're really great, we're going to take them over, or someone says they're going to just let those guys fly because they are really going to be doing something really special. And I bet if we looked across the country, there would be other examples exactly like this. I think this is happening everywhere. There are enough puzzle pieces in place that each region is going to have miracles going on, and every miracle is going to be a little bit different, but there's a lot of excitement. Now, I want to shift the discussion just a little bit because you can kind of see where that there's opportunity for movement here. And the movement is going to pick up, so now we have to figure out how do we manage the transformation. And it isn't just an individual, but it's groups of people, because these are all alliances and these are collaborations that are doing all of these changes. So what we developed as a methodology for thinking through this, and this, I'm going to show you through this little map, and much of the core information came out of Premier at a HIMSS conference presentation. I said, this is it. This is exactly what people need to understand, what they have to go through to manage the transformation. And this is a condensed version, and it's been changed significantly since Premier came out with it, because we said, what do we have to do to think about not migrating technology, but migrating strategy? So, whoops, guess I'm not very good at this. I'm going in the wrong direction. Okay. You notice that I broke this down from the left to the right is where we stand as transactional, and where we're headed toward is transformation. We have to transform healthcare. And up here in the right-hand corner, it says the triple aim. What we're really talking about is integrated and improved care for the patient, the population at reduced cost. I mean, this is what the country has been targeting. And up at the top in the yellow are the drivers of change, and down below is your technology, which is the enablers of change. And that's a very important distinction between who is the driver and who is the enabler, because we now have to start to work together with other people, and what role do they play. Under the drivers, we have changes in care delivery, metrics, and the payment model. So on the very left-hand side of change in care delivery, which is, let's just get people on HIT and HIE. And then the far-hand side, the triple aim, is fully integrated care. And the transition phases are, let's just get the interactions going, like for coordinated care, and that's taking the HIE and the electronic tools, and let's start talking to each other. Integration is your integrated delivery network, and collaboration is moving the community-wide so that you can have community-wide, fully integrated care, not just within an integrated system. The metrics, we're moving from patient outcome measures to population health and health status. On the payment model, we're moving from fee-for-service and providers at risk. And this providers at risk is really important because this is a very, very big driver. And I will give examples of places where this has already started to happen. On the enabler side, we have the analytics, the transaction requirements, and the infrastructure. The infrastructure is moving from interfaces to improved data access standards and interoperability. Transactions are moving from certified EHRs and meaningful use to tools embedded in the workflow, longitudinal record, remote care, wellness. None of this is new to you. I'm just repeating what we all know. And we're moving from provider-centric analytics to population-based reporting and predictive modeling and forecasting. Now, what's very interesting about this predictive modeling and forecasting is it's the area of the health plans. And this is an area we're moving into. This whole analytic roads are very strong in it. We have the tools down here, but we have to move into the territory that have traditionally been to the health plans. So what does that say we need to be doing? This is just a detailed version. I have some extra copies of the details if you want them. I want to move quickly through this particular example to show how this can work. Healthy Nevada, does anybody know anything about the state of Nevada? It's relatively small. It's not even rural. It's pioneer. They have two big cities, Reno and Las Vegas, and that's where all the big hospitals are. And it's got, I think it's like 48th or 49th in health rankings. But yet something very interesting is happening. They have a QIO which has had the hospital, or has been organizing the hospitals on quality and safety programs, so there's a tremendous amount of trust that's been given to them. Then they become the regional extension center, and now they're the health information exchange. Well, if you think about that network discussion we just had, there's a lot of synergy right there with one organization being able to pull all the collaborators in to talk about all three of those. But what interesting thing they have is that of their 5 hospital networks, one of them has already been functioning like a full ACO for years. Most of their income is at risk. They have 2 large practices with about 150 physicians involved. They're fully at risk. So, and then they have about 50 to 60% of their physicians that are onesies and twosies and will be paper-based forever. Now I ask you the question, if you look at this map, what's the issue they've got here? They're sitting, whoops, I'm not very good at this. They're sitting over here with very large systems operating at this end, and they've got some other payers that are way down here, and then they got a lot of hospitals and a few doctors in the middle. What do you do with that? You're a vendor, you're a service provider, you're the HIE. You have got to, healthcare transformation in that region, you have got to figure out how to move everybody along, or if you're a vendor, you've got to figure out which segment you're going to go after. Michigan seems very much like Pennsylvania to me. It's a very large state. It's a very diverse state. It's got very, very large cities such as Detroit, and it's got the rural areas, and it's got the medium-sized cities. And several years ago, they organized in the medical referral regions, and they've abandoned that strategy, but as you'll notice today, that the strategy still survives. When they first started organizing health information exchanges, they couldn't quite get Blue Cross Blue Shield to figure out how to participate. And yet, so Blue Cross Blue Shield went out and started organizing patient-centered medical home models, and they now have 36 practices doing it, and they are have shared revenue. They now have their MyHIN resource services, which was the state-level HIE that can move the data between regions. They have 6+ HIEs off the ground or on the ground, and the University of Michigan Medical Center said you must join an HIE. So what do you do with that? To me, this looks like action waiting to happen. Now, I spoke in front of the physician community, and they're panicked, absolutely panicked. They're going, we can't figure out whether to join a hospital system or not, and we've got multiple systems trying to get us to join them, and we don't know whether to be part of their integrated network or become employees. So we did a little map for them. And we said, okay, you have to look not at, if you're looking at, you need to evaluate a hospital, you shouldn't just let the hospital evaluate you. Where are they going on healthcare transformation? Will that hospital, will those partners, those physician practices that you want to partner with, where are they on the healthcare roadmap? So this is all a questionnaire to just say, the people you're thinking of partnering with, you know you have to partner, you know you can't do it yourself. Where do they stand on the healthcare transformation roadmap? Because you want to be partnering with those with complementary skills and are on the roadmap. Now, how many of you have been paying attention to what's been going on with HealthBridge? Just a few of you. So they made an announcement just, I think, April 25th. I don't even know if that's a week ago, that they were going to offering analytics infrastructure to Quality Health Network, which is in Colorado, which has the highest outcomes and the lowest cost of care in the country. So those folks are going to be pretty picky. So what HealthBridge is doing is they're offering Quality Health Network the infrastructure to make sure that there is secure and accurate integration of the data as they have these large data sets flowing through their system. They have an analytics engine that's going to ID the gaps in care. They're going to have the business intelligence to manage resources, risk, quality, utilization, and they have the reporting tools that enables them to slice and dice the data in multiple ways in multiple reporting requirements. Now, if you knew HealthBridge, this is a huge leap for them. HealthBridge and Indiana Health Information Exchange, although they're extremely well known, they became sustainable on basic, simple transactions. They didn't do sophisticated stuff. They did high volume, simple transactions, and they did a HealthBridge on clinical messaging. They deal in the millions of transactions, but they're not doing sophisticated care that we're now calling for. So they did get a Beacon grant, so did Quality Health Network, and so they said, okay, let's take our Beacon grant, let's take that as a jumping off point and see if we can build products and services based on what we learned from Beacon. Now, I got involved with them because this is a huge transformation that they have to go through at HealthBridge to get everybody to agree to do this because they're used to doing the bread and butter. Let's just crank out the transactions. And there was a lot of conflict on the board because the board was having difficulty figuring out, well, where do we go with all of this? Because the hospitals are demanding something very different. They're forming ACOs, and they say, what do we need HealthBridge for? And there was another entity that was said, well, we're the quality group. You can't be the quality group. So lots of conflict, and I'm willing to bet that this kind of conflict is happening in every single community that you're in right now. Not the opportunities also create the risks. So one of the things that happened, and I'm going to describe what happened at the board meeting. They went through this, and put my pointer here, and the board came to the realization, the staff had done that 6 months earlier. Hey, guess what? If all the hospitals are trying to get up here, our region's trying to get up here, and our services are right down here in this corner. We are way far away from where we need to be. Well, this is just the IT infrastructure. We have to take our IT infrastructure all the way here. And we have to take our applications and we have to move them all the way here. And then we're not even in analytics, and here's my pointer. We have to take them from nowhere to here. That is a huge leap that they have to make. And they said, in our market, when we have a mature market, we can't not do that. So they took that leap and did it. They also figured out that the quality group that they were in competition with was right up here in this row. That quality group was a report card. And in a report card, you're actually evaluating something. And down here, when you do analytics, you're just managing the data. You're not doing it or evaluating the data. And they said, we need to be the trusted entity. We don't want to get involved in evaluating the data. So they said, we own this down here. And that's really basically what happened, is the backstory to that Quality Health Network participation. Is Quality Health Network said, we need this too. We can't afford to build it. We're too small, so we're just going to buy it. And so I think this is an example of the kind of transformation that you're going to see. And if you're a vendor, you're sitting here saying, well, okay, if there's other organizations who are thinking this, what piece of this puzzle do we want to contribute to? And we want to get hooked up with those organizations like HealthBridge that are moving down this path. Now, is this making sense to everybody? Because it's really figuring out who all the other players are and who's moving down these paths and where do we belong on that path. So I want to kind of have a little bit of a discussion about this and say, is this the kind of healthcare transformation map or way of thinking that would be useful in your organization or in your community, regardless of the role that you're playing? So any thoughts on that by anybody? Can you see this working for you, or do you see anywhere where there's lots of network relationships that have started to emerge?
Yeah, I just had one question. There are a lot of different networks, a lot of struggling HIE. Sustainability is obviously one thing that always comes up. How do you see the different networks versus HIEs that were started with Beacon grants that are struggling? And in those cases, some of the payers look like they're backing out because they haven't gotten the gains from the initial HIEs that they wanted.
Well, I've sort of redefined success a little bit. So people are like, I don't think all of them are going to survive, and I don't think all of the beacons are. I don't think all of these initiatives, but the people who are in them are reconfiguring themselves. They're not going to go away. They see the market, they see the opportunity, and you now have a whole bunch of educated people, and so I think you're going to start shifting those networks. And so, I will tell you at first, when all of this transformation started with high tech, and I got depressed because I was on the HIE side and I saw the HIEs dwindling because the community HIEs, because they weren't getting funded. And then I had to give that up. And now I can see that the community HIEs, for instance, with the need for accountable care, will eventually come back to those community HIEs, because accountable care organizations need community-wide data. It's not, health system is not enough. So once I let go of this institution has to be preserved, but say we can reconfigure all of this to make healthcare transformation work, then the door's open for me.
I have a follow-up question. I have a follow-up question to your perspective, which is, thank you, it's really terrific. How do you think about the role of these organizations? Because there seems to be a tension between narrow and broad. The narrow would be, as I'm using the term, the role of the HIE is to create a secure pipe and process for the transmission and normalization of data, period, full stop. A broad definition would be, no, we're in the metrics business, or we're in the PCMH business, or we're helping facilitate ACOs. We're transforming healthcare. And it seems that things sort of break down in one of those two camps. How do you think about that?
I think it can go either way. And some communities, if you have a fully functioning HIE, the ones that are fully functioning got started a long time ago. And so they have a very large footprint, so they can play a more transformative role. Those that got started after high tech, when there was a push by the hospitals for private HIEs, the integrated delivery systems, there was a much smaller role for the community HIE. And so you have to really kind of look and say, how big is this role that we have and is available to us? Are we just connecting integrated delivery networks and private HIEs? Are we the whole system? And how many providers and other data sources are left without, they're not part of those integrated networks. So I think it's going to be different for each case, and I think you just have to be open to it. But the more integrated delivery networks you have, the more private HIEs you have, the harder it is for a community HIE to be sustainable because there aren't enough transactions. Buddy.
Cam, as I look at the healthcare transformation roadmap, I think about the HIMSS analytics EMR adoption model.
Right.
And it would seem that these two might run concurrently, because the further up that seventh layer of analytics for the ultimate EMR adoption model achievement really seems that would complement what your roadmap here is. That where you?
Yes, I agree. I mean, you can literally add rows and rows and rows. Whatever your vendor, whatever you do as a vendor or a service provider, map it and say, where do we line up with each of these stages?
Camille, I got a question for you regarding the technology transformation and how it's enabling the transformation of healthcare, and that would be the role of direct in the technology transformation and how much impact it will have nationally as well as internationally.
Well, I think it's been a tremendous start, and some of the regions are doing much better than other regions. I think it has opened the doors to get more and more participation. I think I saw that survey just the other day on the EMR adoption has gone from like 20% to 50 to 60% in 2 years. That's amazing. Now I know there's going to be folks left behind, and there's going to be more work that's required. And I'm hoping that those people who have come out of the wreck, they are very experienced. They know who they're not catching, and they may find opportunities as those wrecks transform themselves to figure out how to serve that group hasn't been reached yet.
Have you seen examples where they tried to reduce the variation of care simply based on claims data and realized they were off and they couldn't reduce the variation without the clinical data?
I have not seen that example, but I actually understand why that would be true. So no, I haven't. Mostly I'm working with the clinical side, and except for that one example that I gave, I think that what I do see is more and more effort by the health plans and the providers to get together. And I think they know that they have to get together. That example that I gave in Nevada, they've got one of the health plans did the initial funding of the HIE, and then they brought in the coalition of casinos and the employees union. And what was really exciting about bringing in those two groups together is now the health plans have a very big voice. But it's not a demanding voice, and they have a very high percentage of the market. So I'm very hopeful for regions like that. I'd love to see the clinical and claims data together, and the Health Bridge definitely is moving to get that claims data because they know they can't do the analytics without it.
There's one important person that's not on that chart. It's the patient. And I see this as the biggest roadblock because I've seen it as a vendor just in trying to deal with immunization systems where you can't move information from state to state easily. The ONC has said, because I've sat in on all of NEHIC's seminars about it, HIEs in the last month or so, ultimately the goal here is that patients have access to their records whenever and wherever they need them. It's not clear to me how HIEs solve that problem. even in the example you gave at the beginning. It's one thing to say most of your healthcare is delivered regionally, but if you're on vacation in Disney World, your records don't follow you from Pennsylvania to Florida easily, and I don't see that this map really provides a model for that level of exchange yet. So I'm wondering, does the patient even have a role in this, or is this largely provider-driven and patients need to deal with the records outside of this?
I think you make an extremely valid point. I have a detailed map that shows the patient role more clearly. So as you move this way, it does do that. So valid point, and some of that is in there. But let me tell you a very interesting example that happened in Nevada. It's an opt-in state, and we had a big meeting with 200 people, and everyone said, what is your biggest fear? And 200 people said, opt-in, we'll never get the patient. And then they put their head around it and said, you know, you have to have the patient just like you have to have the doctor. So they started doing actively, what do we have to do to get the patient on board and in the game, because this will never happen without it. And it's amazing when you're faced with an issue like that, you figure out how to do that. So I think you're going to find, if you follow those opt-in states, I think those are the ones that are going to have to figure it out first.
Texas proved that with their IIS, right? If they move from opt-out to opt-in and their participation rate was plummeted in the course of a year.
Well, that means you have to change the way you think about engaging the consumer. You have to really be active at it, and that's the transformation. And so all of a sudden I'm thinking, okay, opt-in is a pretty good thing, if you understand that. And I think I'm out of time, is that right? Okay, well, thank you, everybody.